Welcome back to Kinesiologically Thinking. Today we're going to be discussing the anatomy of the spinal cord. The spinal cord is a very important central highway to your entire neural network, making it a very interesting piece of anatomy to discover. Let's get started. What are the specific aspects of the spinal cord? First, we have enlargements. These are areas of the spinal cord that are slightly enlarged due to an increase of nerves branching out to plexuses. The cervical enlargement is found in the cervical region and is associated with the brachial plexus, and the lumbar enlargement is in the lumbar region and is associated with the lumbar plexus. Next is the medullary cone. This unique area of the spinal cord is found around the T12 to L1 level, and you'll notice in the lab that it will look exactly like a little cone, like our little diagram here indicated by the pink triangle, and the rest of the spinal cord as the blue line. It is important to help stabilize the spinal cord to the coccyx. Next, we have one of my favorite anatomical parts, the cauda equina. Literally translating to horse's tail, this piece of anatomy is in fact still a part of the spinal cord, but is essentially early divisions of spinal nerves to be sent off down the lower body and legs to continue further nerve branching. This early branching makes several smaller cords appear from the spinal cord looking like a horse's tail, which we can visualize here in green. Next up is the terminal filament, which is the filament that actually branches from the medullary cone to anchor the spinal cord onto the coccyx, which we can see here in yellow. The dural sac surrounds the spinal cord, providing protection for our spinal cord, which is very important since this is where all our motor and sensory information is transmitted along. The next logical area to dive into is the meningeal layers of the spinal cord. So from superficial to deep, we have the dura mater, arachnoid mater, and pia mater. You can remember the arachnoid mater by its spiderweb appearance. Now I'm going to use a little analogy to help you remember these layers, so listen closely. Looking at our little character in the right-hand corner, you're going to think of the actual spinal cord as the foot. Then your pia mater is going to be the socks that they are putting on. The arachnoid mater is going to be the cushiony inserts you put into your shoes for extra support, and then the shoes themselves is the dura mater. The space outside of the dura mater is referred to as the epidural space. The space between the arachnoid mater and pia mater is the subarachnoid space, where we find the cerebral spinal fluid. Now, let's understand the formation of a spinal nerve. So a spinal nerve is going to arise from the spinal cord and will exit to the various parts of the body via the intervertebral foramen. Check out our vertebral column video for more information about the intervertebral foramen. This little drawing helps us to visualize this, so we have that spinal nerve exiting our spinal canal through that intervertebral foramen. From there, each spinal nerve will divide into two rami, an anterior rami shown in purple and heading anteriorly, and the posterior rami shown in blue and heading posteriorly. Zooming in further, in each rami has three prior divisions before it becomes a posterior or anterior rami exiting from that intervertebral foramen. The rootlets, shown here in light orange, branch directly from our spinal cord, both anterior and posterior rootlets. The rootlets come together to form roots, again both posterior and anterior roots. The roots come together to form the actual spinal nerve, which then branches into the posterior and anterior rami. Zooming out, we can see how sensory and motor information travels to and from the spinal cord. Sensory information only travels through posterior roots and posterior rootlets, going both to and from the spinal cord. Motor information is going to only travel through anterior roots and anterior rootlets going to and from the spinal cord. So imagine if you're kicking a soccer ball, the transmission of doing the actual kicking movement to kick will be sent from the brain along the spinal cord out through the anterior roots and rootlets. The sensory feedback from our foot from kicking the ball will travel back into the spinal cord through the posterior roots and rootlets. Note that the spinal nerve and both posterior and anterior rami carry both motor and sensory information. It isn't until you get to the level of the spinal cord at those roots and rootlets where the information divides. So, are you an expert at the spinal cord now? Find out by doing our quiz. You'll have 15 seconds to answer each question. Be sure to keep track and comment your score. We would love to know how you did. Question 1. Where is the medullary cone located? Time's up. The answer is T12 to L1, or thoracic vertebrae 12 to lumbar vertebrae 1. Question 2. Why is it called the cauda equina? The answer, because it looks like a horse's tail. Question 3. What is the deepest meningeal layer? That would be the pia mater. Remember, it's like the sock in our analogy, closest to the foot, the spinal cord. Question 4. Where do spinal nerves exit from? If you got intervertebral foramina, you are correct. Last question. Which parts of the spinal nerve carry only motor information? And the answer to our final question is anterior roots and anterior rootlets. A way to remember this is the action you want to perform will come out the front door of the spinal cord, and the feedback you receive will come back in through the back door of the spinal cord. How did you do? Let us know in the comments, and be sure to comment what other anatomy videos you would like us to explore on this channel. Thanks for watching. Make sure to subscribe and like this video if you found this video helpful and to help support a fellow student. Thanks everyone, and have a wonderful rest of your day.